The dreaded coronavirus started from Wuhan, China in 2019. Gradually, the virus started spreading across the world, with Nigeria recording its index case in February 2020 through an Italian citizen who traveled from Lagos to Ogun State. With this development, the Lagos State government immediately swung into action and the patient was successfully managed. Just when the governor, Babajide Sanwo-Olu, and his team were about to heave a sigh of relief that they had broken the chain of transmission of the dreaded coronavirus, the real challenge began. From imported cases through some foreign nationals, the transmission of the coronavirus metamorphosed into community transmission, a situation that now seems to be so much demanding on the Lagos State government. Lagos State at the moment has recorded over 6,000 confirmed cases of coronavirus, over 5,000 active cases, and about 72 deaths out of the over 22,000 samples tested so far to remain as the epicenter of the viral infection. At the moment, all isolation centers in Lagos State are getting filled to capacity, a situation that has necessitated the home isolation initiative, which will see asymptomatic cases managed from their homes and more involvement of private hospitals.
As a government, redefining our strategy because, as you know, we've been testing more. We've been escalating our capacity to test for COVID-19. And what we found is that the more we test, the more we find, which is a reflection of the fact that COVID-19 is spreading within the community. And we're finding more cases than we can manage eventually when we project. If we carry on with the rate of positive testing that we're obtaining, we're going to run out of isolation beds in our established isolation facilities. Therefore, we are projecting, if we keep getting 150, 200 positives every day, in another 2 or 3 weeks, even though we are opening new isolation centers all the time, in time, we're going to run out of beds. And this has happened all over the world. It's not just Lagos.
More worrisome is the laxity and disregard of most residents to safety precautions, such as the practice of physical distancing, the compulsory use of nose masks, and others.
The commercial driver, I don't think there's a way of controlling them because they are still carrying more than enough. Instead of 2, they are still carrying 4.
The increasing transmission of the COVID-19 infection is not exclusive to Lagos, as more states across Nigeria are beginning to confirm more positive cases, given the improvement in testing capacity. This coming at a time when the Nigerian government is opening up all sectors of the nation's economy. There are fears that the decision could be counterproductive and result to a second wave of the COVID-19 infection, which may be more deadly. Some experts are also calling on Nigerian government to take aid from the lessons of the 1918 Spanish flu, the deadliest pandemic in history that affected an estimated 500 million people across the globe and killed up to 50 million people in 15 months. The 1918 flu pandemic, popularly called the Spanish flu, was a deadly strain of influenza. At that time, there were no effective drugs or vaccines to treat the killer flu strain. Like the coronavirus pandemic, then nations had to take precautionary measures with the option of enforcing lockdown by having schools, businesses, religious centers, and other social places shut down, restrictions on the movement of citizens, and the option of wearing face masks to control the spread. The Spanish flu infection reportedly had a low fatality rate, as people who got infected were most likely to recover. But then the second wave occurred later in the same year and became highly infectious, killing infected persons within hours or days of showing symptoms. Though the global fatality from the coronavirus is still very, very far from the Spanish flu figures, there are concerns that if the situation is not properly managed, especially in Nigeria, history could be repeated, given the increasing number of COVID-19 cases on a daily basis.